Well, good morning. Thank you so much for being here with us today. My name is Nancy Kukovich, and I am the chair of Pennsylvania 211. If people don't know where to turn for help, we encourage them to call 211. It's like 411, but for health and human services. The United Way system in Pennsylvania has a vision for 211 to serve three major objectives. The first is to connect people in need to health and human service assistance available through government programs and private nonprofit organizations in their communities and throughout Pennsylvania. The second is to provide assistance to communities in time of disaster, allowing 911 to work primarily with first responders and 211 to help everyone else. The third is to connect volunteers and donors with organizations who can leverage these resources to meet the needs of the community. In 2017, there were 199,000 contacts made to 211, and that's phone and text and internet. That's a 30,000 increase in contacts from 2016. Currently in Pennsylvania, 97% of Pennsylvanians can pick up their phone and be connected to a trained call specialist, and many can get texting for 211 too. In 2017, 211 was expanded into the northwest region of the state, allowing many more the access to connect to services in their area. For the first time in the history of 211, in Pennsylvania, the Commonwealth made a commitment to fund 211 with an initial investment of $750,000. We are grateful for the support of the Commonwealth and look forward to opportunities to partner in order to provide all Pennsylvanians ease of access to these resources. Pennsylvania 211 has had a busy year with lots of success to be proud of. Not only did we expand into the northwest region of the state and receive a first-time investment from the Commonwealth, 211 has also had the opportunity to partner on some exciting projects, including the launch of Connect to Home, a coordinated entry system for Eastern Pennsylvania, and the partnership with the CDC to provide information regarding flu on-call project. I have some speakers here who have been partners with us in putting 211 together, and I'd like to give them each an opportunity to say a few words. So please welcome Representative Stephen Bloom, a legislative champion for PA 211.
Thank you very much. Every day, my staff and I talk with constituents in my district who find themselves facing difficult health and human services dilemmas and challenges. The good news is that there are many resources available to help these individuals, from government programs to private, nonprofit, and ministry organizations in their communities. There are so many resources, in fact, that it can be very easily become overwhelming for a person to know where to begin to seek help. This is where the 211 service comes in. It's a gateway to all kinds of help and the right kind of help. Individuals can get a holistic answer to their issue rather than an incomplete response that may only lead them to additional challenges. In 2017, the increase of 211 contacts by over 30,000 people is an example of how many Pennsylvanians truly need help in finding resources for their everyday lives. The work United Ways are doing to bring more awareness to 211 in our communities is a vital part of the success being experienced by those seeking services. It's my hope that with the availability of resources provided by 211, fewer Pennsylvanians will find themselves in hard times because of the inability to get the timely help that they need. With the availability of 211, I support future partnerships between this service and the Commonwealth. I'm supportive of this idea because I believe we can prevent many more of these crises that I described from happening to our neighbors and our friends, and because there's also an opportunity here to increase efficiency and cost savings in the delivery of health and human services. For an example of a partnership, PA 211 is currently contracted to train resource specialists to assist with pandemic response in partnership with the CDC and other 211s across the country through the Flu On Call project. Flu On Call is a plan which would be activated in the case of a pandemic. While this season's flu is deemed widespread in most of the U.S., states, and territories, it's not currently a pandemic. In a pandemic, large numbers of people are ill and seek care. There's a surge on medical facilities and potentially a delay in seeking care that can also impact access to antivirals. In the event of a pandemic, 211s in 12 states would staff triage lines along with trained medical professionals to provide public information and clinical advice about pandemic flu. I look forward to continuing to work with United Way, my House colleagues, Senator Brown, and others to help provide more efficient, comprehensive help for Pennsylvania's health and human services need through a public-private partnership for 211. Thank you.
Now please welcome Senator Pat Brown, another legislative champion for 211.
Thank you very much. On behalf of the Pennsylvania Senate, I'm very proud to join my colleague, Representative Bloom, all the officials for the United Way Pennsylvania, all those who are wearing green here in the Capitol today. I think today is going to rival St. Patrick's Day here in Pennsylvania, to highlight and to strengthen the partnership for a tremendous resource here in Pennsylvania for the benefit of our citizens. Ladies and gentlemen, part of the responsibility of any member of the General Assembly is to be intimately aware of the myriad of issues that residents of Pennsylvania face on a daily basis. My legislative staff, along with staffs across Pennsylvania, work tirelessly with constituents every day to help provide assistance and in partnership with the tremendous system of social services in the Lehigh Valley to direct them where they can receive the help or guidance they need. However, through the power of technology, we can always do better. The PA 211 system provides that same crucial and quick connection between people in need and the assistance available to them in their communities, but on a 24-hour-a-day, 365-day-a-year basis. Whether a person or a family is in need of help for veteran services, senior care, or assistance with opioid and other drug addictions, this one-stop shop possesses the most comprehensive database of public and private resources available to residents in their communities. As the largest private funder of the 211 network in Pennsylvania, the support of the United Way gives the 211 program has been critical to supporting these services and helping so many Pennsylvanians. Hundreds of thousands of Pennsylvanians have already benefited from this program, and with financial support from the Commonwealth, their service can continue to grow and help more individuals and families. This is why we are collectively leading an effort to develop a statewide public-private partnership and establish a statewide 211 system grant program. This will enhance the already established PA 211 system by providing grants to qualified applicants for the development, implementation, and operation and support of a statewide 211 system. To ensure its success, 211 received its first ever appropriation of state funds in the 2017-2018 state budget. And that came through the leadership and advocacy of those standing with us today. As part of this partnership, United Way and the 211 system are launching the Connect to Home project in the Lehigh Valley. This is an excellent example of how this partnership can and should work. The Lehigh Valley is partnering with 211 to pilot a program aimed at providing an access point for housing and homeless services for individuals who are either already homeless or immediately at risk of becoming homeless. Those that call will receive standard pre-screening to assess their current situation, and then 211 will conduct the assessment utilized by the whole compendium. It is a strategy to connect people to the right services as quick as possible, prioritize based on need and vulnerability, raise intimate awareness in the community regarding the challenges of homelessness, and enhance the data-driven decision-making for planning, resource allocation, and performance evaluation. But this is just one example of how the PA211 system's vast resources and community knowledge can provide vital information and direction to so many Pennsylvanians in need. Building on the incredible work the United Way has done for the 211 system and the financial resources it has delivered, I am pleased the Commonwealth is joining in the effort and is financially supporting this referral service that is tremendously helpful to our citizens. This investment in the 211 system will streamline and improve the delivery of services to Pennsylvanians and also achieve cost savings for state government. At their core, ladies and gentlemen, Pennsylvanians are driven to serve. It is why the Commonwealth in all regions has an extraordinary portfolio of social service resources. With this outstanding partnership and the leverage provided through technology, we will ensure that all Pennsylvanians are given the assistance they require when they are most at need. Thank you very much.
Representative Bloom and Senator Brown, I want to thank you so much for the work that you have done on our behalf. We are, of course, excited about getting our first allocation, but even more excited about the partnership that this advances in the Commonwealth. The final speaker here today, well, not quite the final. I have one more. The Human Services Director from Dauphin County, Randy Yeager, is here, and she's going to tell you a little bit about how a county responds with 211. There you are.
Thank you. Good morning. I appreciate being here on behalf of the Dauphin County Commissioners. The Dauphin County Commissioners have had a long-standing relationship with our local provider, Contact Helpline, under the direction of Kelly Golick. That contractual relationship has existed for over 30 years. And that entity has long-standing provided our referral and information resource. They also provide anonymously an opportunity to be an active listening component for individuals in our community who really just need someone to talk to. 211 is such a wonderful opportunity. It's an easy reference number. It's something that our citizens can easily remember, and it's very, very helpful that all of those systems are now connected across Pennsylvania. Oftentimes we may get calls in our own health and human service departments related to someone in need, but not necessarily a resident of Dauphin County, so it's very helpful to have all those connections solidified. We have also had the benefit over the past several decades that our 24-hour non-emergency services is our backup contact for crisis intervention through Contact Helpline support. When our staff is already at hospitals and cannot be there to answer the phone, it's an automatic backup system. That is a huge benefit with reduction in resources across human services, that we have all of these entities working together to help the citizens who are having critical needs at any time, day or night. Thousands of individuals receive the information they need by contacting 211, and what an awesome feature now to have the capabilities of texting across all counties, and we're just very grateful for the support and the continued solidification of those connections across the state. I thank you very much for your time.
Last but not least is Ann Fogris. She is the United Way of Pennsylvania statewide 211 operations. We have regional centers across the state of Pennsylvania, but here in Harrisburg, Ann tries to kind of tie everything together and make sure that everyone is all on the same page. Ann?
Thank you. Good morning, everyone. I'm pleased to share with you today some additional information about our project with the Eastern Pennsylvania Continuum of Care Project, Connect to Home, and our work in disaster response. Both projects build upon the strengths of 211, including the easy-to-remember number for the public to call, and a professional and compassionate staff very knowledgeable about a wide range of community services. First, let's talk about housing. Housing has always been one of the top needs of callers to 211. Safe and affordable housing is important to individuals and to helping communities thrive. 211 has always recognized housing as a key area where we could work with other community partners, so we're now pleased to be working with the Eastern Pennsylvania Continuum of Care to provide coordinated entry services for their 33 counties. Coordinated entry is a system that coordinates access, assessment, prioritization, and referral for housing and other supports for people experiencing or at imminent risk for homelessness. HUD has mandated that all communities adopt a coordinated entry process by January 23rd of this year to continue to receive HUD funding. 211 is the 24/7 phone access point for people who are homeless or immediately at risk of becoming homeless. If you call 211, you will receive a standard pre-screen to determine if you're homeless or immediately at risk, and then we will do the assessment that the entire 33 county continuum has agreed to use. Individuals may call 211. They may also visit physical access sites that are available in some communities. You can call 211 for that information as well to receive the assessment and referrals to community services. We encourage people to call 211 or to text their zip code to 898-211 for this information. The second project I want to focus on is our disaster response. Our easy-to-remember 211 number comes in handy in emergencies and disasters as well. PA 211 works with PEMA and the state and local VOADs on trainings and exercises to ensure that 211 is ready to respond in an emergency. This year we were called upon. Our Northwest 211 region was called to action in December when the snows hit in Erie. They responded to 1,264 requests for help for snow shoveling from seniors, from those with disabilities who needed help. They were able to screen these callers and get them connected to Team Rubicon for snow shoveling services, and kept those phone calls from the 911 system. Flooding is always a possibility in Pennsylvania, and 211 is ready. Our Southwest region responded to 368 requests from Butler County last July when people's homes were flooded. They called for services like having their basement mucked out. They needed food. They needed help with getting utilities restored. The call to 211 was the first entry point, and we were able to connect people to services so that there were better days ahead for them. PA 211 also responds to national disasters as part of our national 211 network. In the fall, we joined a disaster response for Hurricane Irma. Several of our centers responded to texts from individuals in Florida. Our Southwest Center handled calls from Broward County and talked to 1,289 Floridians. Sharing the responsibility for disaster response across the 211 network allows the home communities to deal with their personal issues related to the disaster while continuing to provide uninterrupted service to those calling 211. As the local centers return to full capacity, the national response stands down. That is the strength of a coordinated 211 system that Pennsylvania is proud to be a part of and to have developed in Pennsylvania. We are poised to help with other projects to help our communities thrive as well. I will, go ahead.
Thank you. Well, that wraps it up for today. You've got a lot of information at your hands, and we hope that cutting all the way through it quickly is 211. Call if you need help. Thank you so much.